Namaste, I am Name-shamaila Siddiqui, Faculty of Physiotherapy and Diagnostics. Today I will discuss about the cell injury and its causes. Cell injury topic is a very important part for our program like BPT and TPT. So, cell injury. The cell injury is defined as it is the process through which a cell is damaging and start to behave in a different like a manner. In some cases with negative influence to the rest of the cells and organs and the repair mechanism of the cells and organs what was damaging, and it is the mechanism that the cell has to restore at its normal functions. The causes of the cell injury. The main causes of cell injury is hypoxia. Cell injury means a damaging of the cells. The hypoxia is a main common cause of the injuries, and lack of oxygen leads to the inability to the cells to synthesize sufficient to the ATP by the aerobic respiration. ATP, adenosine triphosphate. Thirdly, the major causes of hypoxia is ischemia. The ischemia, it is defined as the decreased arterial flow and the decreased venous outflow. The ischemia including atherosclerosis. Atherosclerosis, it is defined as hardening and the narrowing of the arteries, and it can put the blood flow at risk of the arteries become blocked, and it is called atherosclerosis. The atherosclerosis, it is the usual cause of the heart attacks. Usual causes of the heart attacks and the strokes and peripheral vascular diseases. The next causes of cell injury, thrombosis. The thrombosis is defined as it is the process of the blood clot, also known as a thrombus, forming in a blood vessels, and these blood vessels can block or obstruct blood and flow in the affected areas as well as cause serious complications. If the clot moves to a crucial part of the circulatory systems and the circulation like brain and lung. The next injuries are cardiac failure. Cardiac failure means sudden and unexpected loss of heart functions. And sudden heart attack failure, breathing and consciousness, and in cardiac arrest the heart stoppage of the beating and the without pumped intention, and it can result in the patient lastly stages patient death. The next causes of injuries like infections, viruses, bacteria and parasites and fungal infections. Secondly, productions of the toxins. Increasing the production of toxins are caused cell injuries or cell damage. The next causes of the cell injuries, immunological reactions. Immunological reactions like antigen-antibody reactions. Firstly, the hypersensitivity reactions, and secondly, the autoimmune disease. The next is congenital disorder. Congenital disorders like sickle cell anemia, chemical injuries like drugs, poisons, and cyanide and mercury cyanide. Next, the pollution, physical injuries like trauma, burns, radiations, and nutritional and vitamin imbalance like inadequate calorie and inadequate protein. And some cases, the vitamin deficiency are involved. The various causes of cell injury like vitamin A deficiency, night blindness. These causes are involved in the cell injury or cell damaging. Mechanism of the cell injury are including ATP depletion. ATP depletion means ATP decreasing, and mitochondrial damaging and membrane damaging, DNA damage, and activation of protease, lipase, and inactivation of enzymes and proteolysis of the cytoskeleton. And these are the part of the mechanism of the cell injuries. The most important cause of the cell injury are hypoxia, ischemia, infections, immunological reactions, and congenital disorder, chemical injuries, and physical injuries. And last one is the vitamin imbalance and nutritional deficiencies.